Welcome to our educational and health-focused video. In today's video we will focus on the topic, Top Masturbation Mistakes Men over 50 Should Avoid. This video is designed to provide science-backed information to help men over 50 maintain their sexual health, energy, and well-being through awareness and healthy habits. Masturbation is a natural and normal part of life, but certain mistakes, especially as we age, can affect hormonal balance, prostate health, performance, and overall vitality. In this video, we'll explore the top common mistakes men over 50 often make when it comes to self-pleasure, and how avoiding them can lead to better physical, emotional, and intimate health. Mistake number 1. Overdoing it. Masturbation is a natural and normal part of human sexuality, offering both physical and emotional benefits when done in moderation. However, for men over the age of 50, overdoing it can have unintended consequences on overall health and well-being. As the body ages, hormone levels, particularly testosterone, begin to decline. Excessive masturbation can lead to a temporary dip in testosterone levels, leaving you feeling fatigued, less motivated, and mentally foggy. Unlike in your younger years, where the body bounces back quickly, overmasturbation after 50 can have a more noticeable impact on energy levels, sleep patterns, and even muscle strength. Physical effects may include lower back pain, growing tension, erectile fatigue or difficulty maintaining arousal, soreness or sensitivity in the genital area. Emotional and mental effects may include feeling drained after sessions, lack of focus or irritability, guilt or shame when used as an emotional escape. Overdoing it can also rewire the brain's reward system, creating a dependence on the quick dopamine hit from climax. This might reduce your interest in natural forms of intimacy or physical affection with a partner. Tip: what to do instead. Limit frequency to a healthy level. For example, 2 to 3 times per week may be appropriate depending on your health, energy levels, and lifestyle. Focus on quality over quantity, make each session intentional and relaxed, not rushed. Combine self-pleasure with mindfulness techniques to stay connected with your body. Practice Kegel exercises and pelvic floor strength training to improve control and reduce dependency on external stimulation. Every man's body is different, especially after 50. The key is to listen to your body, track how you feel physically and emotionally after each session, and make adjustments. Masturbation should enhance your life, not leave you feeling exhausted or disconnected. Mistake number 2. Doing it without purpose. Masturbation can be a positive, healthy part of a man's life, especially after age 50. But when it's done mindlessly, or without purpose, it can quickly turn into an unfulfilling habit, rather than a meaningful or beneficial activity. This is one of the most overlooked mistakes mature men make. Over time, this kind of aimless repetition can lead to a numbing of pleasure, where climax feels less satisfying, or even mechanical. Reduced emotional connection with a partner. Dependency on stimulation, for temporary relief from anxiety or stress. A feeling of guilt or emptiness after the act. This habit may also become a way to escape emotions or avoid deeper issues like lack of connection, dissatisfaction in a relationship, or low self-esteem. While the act itself may offer temporary release, it doesn't address what the body and mind may actually need: rest, intimacy, support, or self-care. Mistake number 2. Doing it without purpose. Masturbation can be a positive, healthy part of a man's life, especially after age 50. But when it's done mindlessly, or without purpose, it can quickly turn into an unfulfilling habit, rather than a meaningful or beneficial activity. This is one of the most overlooked mistakes mature men make. Over time, this kind of aimless repetition can lead to a numbing of pleasure, where climax feels less satisfying, or even mechanical. Reduced emotional connection with a partner. Dependency on stimulation, for temporary relief from anxiety or stress. A feeling of guilt or emptiness after the act. This habit may also become a way to escape emotions or avoid deeper issues like lack of connection, dissatisfaction in a relationship, or low self-esteem. While the act itself may offer temporary release, it doesn't address what the body and mind may actually need: rest, intimacy, support, or self-care. What to do instead? Practice mindful self-pleasure, focus on the sensations, your breathing, and the experience as a whole. This increases satisfaction and connection to your body. Explore sensual self-awareness, discover what feels good emotionally, not just physically. This improves not only solo experiences but also intimacy with a partner. Be intentional. Ask yourself why you're doing it. Is it to relax, explore your body, or for sexual release? Avoid doing it just to pass the time or escape feelings. Create a relaxing environment. Dim lights, calming music, or taking time for foreplay, even solo, can make the experience more nourishing rather than routine. Tip: sexual health after 50 is about quality over quantity. When you bring purpose into your self-pleasure, you tap into deeper levels of fulfillment that benefit your body, mind, and emotional health. Purposeful pleasure helps build a better relationship with yourself, and by extension, with others. Mistake number 3, using excessive pressure or rough techniques. As men age, the body naturally becomes more sensitive and less resilient to physical stress. One common, and often unnoticed mistake, men over 50 make during masturbation is using excessive pressure, aggressive strokes, or rough techniques. While it may seem harmless at first, this habit can have serious consequences on sexual sensitivity, performance, and long-term genital health. Many men, especially those who've been self-pleasuring for decades, may have developed habits that involve tight grip, rapid motion, or unconscious tension. Over time, this can lead to what's commonly referred to as death grip syndrome, a condition where the brain and body become conditioned to only respond to unusually intense stimulation. This makes natural intimacy, especially with a partner, less satisfying or even difficult to achieve. What to do instead? Lighten your grip, use a softer touch to retrain your sensitivity. Start slow and focus on feeling, not finishing quickly. Incorporate relaxation. Deep breathing, ambient music, or even mindfulness can enhance the experience and reduce the need for aggressive motion. Switch techniques. Try different hand positions, stroke speeds, or even use the non-dominant hand to break old patterns. Use lubrication. A high-quality, skin-safe lubricant reduces friction, making the experience smoother and more enjoyable. Potential consequences of rough techniques include desensitization of the penis, reducing pleasure during both solo and partnered sex. Difficulty achieving or maintaining an erection without extreme pressure or friction. Erectile dysfunction or delayed ejaculation due to over-reliance on harsh methods. Increased stress on pelvic muscles, leading to tension or even pelvic floor dysfunction. Tip: think of self-pleasure not as a mechanical routine but as a form of self-care. After 50, the goal is not just climax, but maintaining your body's natural sensitivity, hormonal balance, and emotional health. Treat your body with the same care and respect you'd expect in a loving relationship. A gentle, mindful approach can reignite pleasure, improve erectile function, and support long-term sexual wellness. Mistake number 4, relying on porn frequently. One of the most common and misunderstood habits among men over 50 is the frequent and habitual use of pornography during masturbation. While porn may seem harmless or even helpful in the short term, relying on it too often can negatively affect your mental, emotional, and sexual health, especially as you age. Pornography delivers an instant and intense surge of dopamine, the brain's pleasure chemical. Over time, repeated exposure to these artificial stimuli can rewire the brain, creating a dependency that makes natural arousal, whether during solo or partnered intimacy, less satisfying or even difficult to achieve. What to do instead? Reduce or eliminate porn gradually. Try a 30-day break to observe how your body and mind respond. This reset often restores natural arousal and desire. Reconnect with imagination. Rebuild your arousal pathways through memory, fantasy, or sensual awareness. This helps revive natural stimulation. Build emotional intimacy with your partner or yourself by creating a relaxed, respectful space for pleasure. Replace the habit with healthier forms of stimulation like reading, touch, massage, or nature-based relaxation. Potential effects of porn overuse after 50. Reduced sensitivity to real-life intimacy. Your brain becomes trained to respond only to exaggerated, unrealistic scenarios. Erectile difficulties. Men may experience delayed erection or struggle to stay aroused without visual stimulation. Dopamine burnout. The brain becomes less responsive to everyday pleasures, leading to fatigue, low mood, or irritability. Escapism. Porn is sometimes used to avoid dealing with loneliness, boredom, or stress, which can mask deeper emotional needs. Emotional disconnection. Overuse can lead to less interest in emotional closeness or physical affection with a partner. Tip: pornography isn't inherently evil, but frequent dependence on it can numb your body and your brain's ability to experience real pleasure. After 50, sexual wellness is about reconnecting with your body and mind, not escaping from them. Choosing a healthier, more mindful approach to self-pleasure can enhance performance, intimacy, and overall emotional satisfaction. Mistake number 5. Ignoring hygiene. Hygiene is a simple yet often neglected part of sexual health, especially when it comes to solo activity. Many men over the age of 50 may not realize that poor hygiene during or after masturbation can lead to skin irritation, infections, and even long-term health issues, particularly as the immune system weakens slightly with age and skin becomes more sensitive. Hygiene also includes what you use during the act, whether it's lubricants, fabrics, or devices. Using low-quality or expired lubricants or unwashed sex toys can cause allergic reactions or irritation. And let's not forget, cleanliness also promotes confidence, comfort, and a healthy mindset toward self-pleasure. When hygiene is ignored, such as not washing hands, not cleaning the genital area properly, or using unclean objects or surfaces, it opens the door for bacteria, fungi, and other pathogens to enter the body. This can lead to conditions like balanitis, inflammation of the foreskin, or head of the penis, urinary tract infections, or fungal rashes. What to do instead? Wash hands before and after. It seems basic, but clean hands prevent bacteria from entering sensitive areas. Clean your genital area daily. Use mild, fragrance-free soap and warm water to gently clean the penis, especially under the foreskin if applicable. Avoid using dirty towels or bed sheets. Clean, soft fabrics reduce the risk of irritation and infection. Sanitize any tools or toys. If you use sex toys or aids, always clean them before and after use with antibacterial soap or a toy-safe cleaner. Use clean, safe lubricants. Choose water-based or silicone-based lubricants made for sensitive skin. Avoid petroleum jelly or oil-based products unless verified safe. Risks of poor hygiene include bacterial or yeast infections, foul odor or discharge, genital itching, redness, or rash, increased risk of skin tears or inflammation, discomfort during future intimacy or urination. This is particularly important for uncircumcised men, where extra care around the foreskin is essential to avoid smegma buildup and related infections. Tip: maintaining proper hygiene isn't just about avoiding discomfort, it's about protecting your long-term sexual health, promoting confidence, and respecting your body. Good hygiene habits, especially after 50, support a healthier and more satisfying self-pleasure routine, and prevent minor issues from turning into major concerns. There you have it. Masturbation is natural and healthy, especially when practiced in a balanced and mindful way. For men over 50, understanding the body's changes is crucial. Avoiding these mistakes can help you maintain better performance, confidence, and well-being. If you like this video, please like, share and subscribe for more men's health tips, relationship advice, and wellness education for life after 50. This video is for educational purposes only. Always consult with a licensed healthcare provider for medical advice or concerns. Thanks for watching. We will meet in the next video. Take care all of you.